So let me talk to you about one important consideration. And that consideration is I will not, and most professionals will tell you the same thing. If there has been intimate partner violence, or there have been a lot of PFAs that have been founded, or any child abuse investigations that have been founded, that's where I draw the line about including the alienated parent in treatment. I will have to be really persuaded that this person has made tremendous progress in their own therapy and in their own self-awareness, growth, and healing to be able then to be a participant. And the goal for me of reunification therapy, of course, is to move toward the normalization of what most couples are able to achieve uh, when there's a prolonged divorce with children involved, which is to co-parent. We want the outcome to be healthy co-parenting. You know, the children need both parents, and they need both parents to be highly functional. So before you can do that, you have to untangle the uh, the weeds, so to speak, of parent alienation, and how it invades, um, for lack of a better metaphor, the garden of parenting. If you think of parenting as a gardening process where you're trying to grow your children and grow your family, and eventually help them get to the point where they can live independently. So that's the goal of reunification therapy for me, is to get the parents to a point where they can either go out and start co-parenting again with the help of a co-parenting therapist, or parallel parenting if they just can't communicate at all, but they can stop alienating. So let me move on now to talk to you about recent research. So recently, Dr. Burnett, Bill Burnett, and Alan Blotke, excuse me, is a hard word for me to say. They found in their research that the best model for successful reunification therapy involves the treatment of the alienated parent and the children, as well as treatment separately of the alienating parent. Now, you notice I said separately. So the alienating parent isn't brought into the scenario initially. The alienating parent has to be involved with his or her own therapist to get the skills, to acquire the skills and the insights to understand how this is not a productive behavior, how this is harmful to their children, so that even if they don't care for um, their ex-partner, or the mother of their children, or the father of their children, they still have children to raise. My way of looking at that view, and I might have said this to you before, is that when a marriage ends, it's like a company that's building a car shuts down and is no longer producing the car, but you still have to service the car. And in this case, you still have to grow and service and help the children until they reach maturity. So that's kind of the metaphor that I use for trying to do family therapy and trying to heal these broken systems.